Schizophrenia, a complex and enduring mental disorder, profoundly disrupts the delicate balance of thought, emotion, and behavior, casting a long shadow over the lives of those it affects. It is not a singular entity, but rather a spectrum of experiences, characterized by a constellation of symptoms that can range from the acutely distressing to the subtly debilitating. While the precise etiology remains elusive, a confluence of genetic predispositions and environmental stressors is increasingly understood to contribute to its development. At the heart of schizophrenia lies psychosis, a state of profound disconnection from reality. This manifests most dramatically in hallucinations, sensory perceptions that occur in the absence of external stimuli, and delusions, fixed false beliefs that persist despite contradictory evidence. Auditory hallucinations, often experienced as voices commenting on or directing the individual's actions, can be particularly tormenting. Delusions, whether of persecution, grandeur, or bizarre ideation, can shape a person's entire worldview, isolating them within a reality of their own making. Disorganized thinking, reflected in incoherent speech patterns and a fragmented flow of ideas, further compounds the challenges of communication and social interaction. Beyond the florid symptoms of psychosis, schizophrenia also encompasses negative symptoms, which represent a diminution or absence of normal functioning. These include affective flattening, a reduction in emotional expression, avolition, a lack of motivation and goal-directed behavior, and social withdrawal, a retreat from interpersonal engagement. These negative symptoms, often less dramatic than hallucinations and delusions, can nevertheless be profoundly impactful, eroding an individual's capacity to participate in daily life and maintain meaningful relationships. Furthermore, cognitive deficits, affecting memory, attention, and executive functions, can impair the ability to learn, work, and manage everyday tasks, further exacerbating the challenges posed by the illness. The origins of schizophrenia are multifactorial, involving a complex interplay of genetic, environmental, and neurobiological factors. Genetic vulnerability, indicated by a heightened risk among individuals with a family history of the disorder, plays a significant role. However, genes alone do not dictate destiny. Environmental factors, such as prenatal exposure to viral infections, perinatal complications, and stressful life events, can interact with genetic predispositions, increasing the likelihood of developing schizophrenia. Moreover, research suggests that imbalances in neurotransmitter systems, particularly dopamine and glutamate, as well as structural and functional abnormalities in specific brain regions, contribute to the pathophysiology of the illness. The diagnosis of schizophrenia relies on a comprehensive clinical evaluation, encompassing a detailed history of symptoms, observations of behavior, and assessments of cognitive function. Treatment typically involves a multifaceted approach, combining antipsychotic medications, which target psychotic symptoms, with psychosocial interventions, such as cognitive behavioral therapy and social skills training. Early intervention is crucial, as it can mitigate the severity of symptoms and improve long-term outcomes. However, the stigma surrounding mental illness often presents a formidable barrier to seeking help, delaying diagnosis and treatment, and compounding the suffering of those affected. Schizophrenia is a chronic condition that requires ongoing management. While there is no cure, effective treatments can significantly improve quality of life, allowing individuals to lead fulfilling lives and participate meaningfully in their communities. By fostering greater understanding, reducing stigma, and promoting access to comprehensive care, society can help to alleviate the burden of this devastating illness and empower individuals with schizophrenia to reach their full potential.